many of us know the possible impacts of the kind of carcinogens that we are exposed to, what that has on our health. And I appreciate all the work that you've done. My only question is, it's great to do all this academic work, but if you have a governor who doesn't give a hoot about this community and is not going to do anything, nobody in this room thinks he's going to do anything. He's running for president, and he needs big corporations to help support that campaign. The supervisors don't care, the council doesn't care, and the legislators don't care. So my only concern is, it's great to have all this information, but as a layperson, it's information for information's sake. Okay, you're saying no, but what is going to happen legislatively? What's on the agenda now for the future? Because I don't see them doing anything about this after 10 years.
Yeah, I completely hear your frustration, and what I can share is that what we find will help you as individuals and as a community. And having worked under many public health scientists in my career, the things that we find do lead to policy change. So our research at UCLA on leaded gasoline led to the creation of unleaded gasoline, which completely improves the Los Angeles Air Basin and is now a national standard. So, you know, I know that these things seem too far-fetched, but we can make that change, and you know, these kinds of cases help make that change. Okay, last question.
Last one. How long is your study? Isn't there a limit of years? Because I remember we had a time when you reach that limit, that's the end of it.
Well, so we're in the third year. We have 2 more years of the 5-year study, and if we're still analyzing or publishing, we have an option to do what's called like a no-cost extension for another 5 years.
You wait.
Who approves that?
Our scientific oversight committee. And there's on our website, on our who we are, I think about us, like the study team, there's a link to the bios of all of the scientific oversight committee members.
So they could pull the plug in January, correct? Scientific Oversight Committee? That's in the consent decree, though, at the end of the third year.
It is
And
written
it's
into
their
the
option to
consent
continue
decree.
or not. What is UCLA doing to ensure that the study continues for at least 2 more years?
We are checking all the boxes of getting our work done and finding consistency across studies that shows that the work that we're doing is, yeah, we're onto something.
Okay, so wouldn't the cancer research and the clinical evaluations lead to the strongest conclusion of unhealthy impacts because of Aliso? So since those 2 have not been done, isn't the whole study at risk of the SOC saying we didn't see enough in the first 3 years?
I do not believe so.
This community needs assurances that they will, because, so everybody understands context here, the consent decree says after the 3rd year, the SOC can pull the plug. It is to their discretion, and they report into the public health. UCLA can put forward the wish list, but if there's not, the best defense is a strong offense. And there has to be a compelling voice, I think, from UCLA saying this study must continue because of the evidence that we found so far.
Yeah.
And sitting on the cancer research and the clinical for this long puts that at risk. And I've been talking about this since meeting 1, 3 years ago. So what assurances does this community have that UCLA is putting forth the best lobbying effort to keep the study alive?
The Scientific Oversight Committee is fully supportive of our efforts. We're writing a comprehensive report on our 3 years of work to date, and they are the ones who want us to order more years of cancer data so that we can account for longer latency periods. And they understand why we needed to do environmental assessments first so that we could target the right biometrics in the clinical assessments so that we didn't waste anybody's time donating blood that then we didn't test for the right things. assure you that they are fully behind us, and I do not see this study being plugged, like with the plug being pulled. I'm the project manager, so if there was any indication that things were awry, I would know.
Would you please share the letter that you're sending to the SOC with the community?
Oh, it's much more than a letter. It is a very detailed technical report.
We would appreciate it. We want to see this because there has not been any transparency with what the SOC and the LA County Department of Health interface with the community or UCLA.
I will see how we can effectively do that, because some of the things that we're reporting have not been reported to the community yet, and because the SOC reviews them first, so that we make sure that they're grounded and appropriate to present to you as well, that they're sort of our first peer review body. So we would need to talk about that internally as to like what we could make public of that, but I will take that back.
Thank you, appreciate it.
Thank you.